Hello, can you hear me?
Yes, can hear you very well. Thank you.
Great, thank you.
Thank you, Doctor. We'll get started in just a few minutes here, a couple minutes.
No problem. Thank you.
Supervisor Alcorn, I'd also like to remind everyone that we're recording and that it will be live on YouTube, just for everyone's awareness.
Okay, we'll give everybody about another minute. We still have a few people signing on, so just one more minute. Okay, let's go ahead and get started. Welcome, everybody. My name is Walter Alcorn. I'm the Hunter Mill District Supervisor, for those of you that don't know me. Welcome to this Hunter Mill Town Hall meeting. This is the first one of 2021. As the last couple of Town Hall meetings that we've done, this is a virtual Town Hall, and we're doing this virtually because of the topic tonight for this town hall. I'm very pleased to have with us tonight the director of the Fairfax County Health Department, Dr. Ada Ayensu, also known to many of us as Dr. Gloria. So welcome, Doctor. Thank you very much for being with us tonight.
It's a pleasure. It's a pleasure to be here. Thank you for the invitation.
Well, thank you. And I just want to go over a little bit of the format, and then what we're going to do is start this town hall. We have a number of questions that were submitted by folks before this town hall, and we're going to do our best to work through those questions. We've kind of grouped them, and I'll go over the groupings of the questions in just a minute. And then what we'll do is open up to any additional questions or comments, and we'll try to make sure we reserve enough time to do that. We're going to try to do all of this in 90 minutes, so we're shooting for 8:30 as our wrap-up time. And doctors, does that work for you in terms of your schedule?
Yes, that's fine.
Okay, good. All right, wonderful. And thank you. And for technical issues, and I just saw one pop up, somebody was having a hard time hearing, but they did exactly the right thing, which is to go to the chat room and put a question or a note in there. You can also send a message to Lisa Connors. Lisa in my office is running the controls tonight. Thank you, Lisa. And if you have any issues. So first of all, before we get into the topic tonight, I do want to thank everybody for being on this call and being part of this town hall. We got a lot going on in the DC area tonight, and we had discussed possibly postponing this, but frankly, in a pandemic, I thought let's just go forward with this. This is too important to our community, to Hunter Mill and the region and beyond. So we are going to go forward with this. I know some of you may be checking news and other things. The good news is that I guess if there is any good news tonight, that we are moving forward with our institutions. I released a statement earlier this evening. Our institutions are strong. Our belief in the rule of law continues, and we are still a democracy. And my understanding is Congress is coming back into session tonight, and we'll move forward with that process. So anyway, thank you for being here and working with us locally on this most pressing issue of the COVID-19 pandemic. So with that said, let's start working through the questions that were pre-submitted before this town hall. And then again, we'll open up to questions from attendees towards the end of this meeting. So the different topics, I'll just go over those very quickly, fall into several groups. We have several questions relating to who determines when you get vaccinated. We have some more questions relating to the timing of vaccine distribution, several questions on that. We have questions on schools, teachers, question on leftover vaccine shots. We have a question on how to know, a couple of questions on how to know if the vaccine works. Question about older adults, safety, and then some volunteer opportunity issues that also were brought up. So thank you to everybody who before this went ahead and submitted those questions. We're going to do our best to get through all of those. Some of them are going to be grouped together. Hopefully we'll capture at least the main gist of all of your questions. So let's go ahead and get started. So my first question, Dr. Gloria, is in terms of who determines when you get vaccinated. Is that going to be, is it the government or your doctor, or do you need to register yourself with your age or list of medical conditions?
So it is all of the above. I'm sorry, I'm hearing myself echoing.
Let me mute myself and let's see if that works.
Does that work better now? Good. So the advisory committee on immunization has prioritized who should be receiving vaccine based on basically those that are at highest risk for serious illness and death, as well as those who are vital to preserving societal functioning. And that's because, I mean, all of us are susceptible to COVID-19 because it's a novel virus. And unless we are vaccinated against it or, receive immunity the natural way, which is what we're trying to prevent because of the potential for illness and death and so on. Everyone should get the vaccine. However, because it's being developed in smaller quantities, we have limited quantities at this point, so we all can get it at the same time, which is why there's prioritization. Right now, the priority groups are what we call the 1A groups, and these are healthcare workers and residents of long-term care facilities. In our county, that's roughly some 75,000 people or so. So that's quite a few people to get through. The Virginia Department of Health has a three-pronged approach for vaccinating this group. We have the hospitals initially vaccinating healthcare workers who are affiliated with the hospitals. We have, through a federal partnership between long-term care facilities, CVS, and Walgreens, we had that group being vaccinated through that pharmacy system, and then everybody else in 1A being falling in the health department or local health department vaccination program. So that's what we're currently doing right now. And the hospitals, since last week, have agreed to do more than just those that are affiliated with them. So that's all very helpful in moving things forward in a much rapid manner, so we can finish 1A as quickly as we can.
Okay, fantastic. Let's move into a couple of specific questions. Here's one from someone who said, my wife is 73 and has a significant underlying health condition that argues for her to be an early recipient of the vaccine. How do we make this information known to the proper authorities so they can determine her proper place in the queue?
So at this point, we have information for, we're doing 1A, and today the governor also released information about 1B, but we have not gotten the green light to actually start vaccinating 1B. The way this is going to work is that, even though we have these prioritized groups, we will not wait to vaccinate every single person in a particular priority group before we move to the next. Because number one, not everybody in these priority groups want the vaccine and are ready for it. So it's almost like a demand and supply issue that we look at. Every time and we saw this with H1N1, whenever there's a new priority group that is invited for vaccination, there is an initial demand, high demand for that vaccine, and it quickly peters down. We don't wait for everyone in that group to be vaccinated before we move to the next one. But we have a finite number of vaccines to begin with that we get at a time. We never have enough vaccines for that entire priority group. They come in much smaller doses. And so we kind of look at where we are in terms of how much vaccine we have, who in a certain priority group has been prioritized, has been vaccinated. And as we see that the traffic or the demand slows down, we move to the next group. So that's the way we're going to be doing. I'd like to encourage everyone to please bear with us and be patient. We will be moving through these groups very quickly.
Okay, that's good. And let me ask you more specifically another specific question. So I guess depending upon if you're in one of these groups, say you're not 1A, so you're still coming up, will people be given an appointment time by the government, or should folks contact their doctor to make sure they are vaccinated at the appropriate time? What would you recommend?
So at this time, vaccines are only in the hands of the local health departments and the hospitals. But as more vaccines become available, doctors' offices will also receive their vaccines. Prior to vaccine rollout, physicians were invited to basically register to participate in vaccine distribution should it become available. So in a few months or so, I suspect that there'll be vaccine available in physician offices. Vaccine will also be available in pharmacies, and people will have the option, just like we do during flu season, where You can go to your regular doctor if you so wish, or you can go to the pharmacy, or you can go to the health department. But right now, similar to H1N1, because of the very limited quantities, it starts through the governmental public health system, and then it opens up as time goes on.
Okay, thank you, Dr.
We'll be informing. I encourage people to visit our website. We will be updating it constantly as new information becomes available. And so as we move to the next groups, for this group, we didn't make a huge announcement because we went directly to the healthcare providers and invited them. We know how to reach out to healthcare providers. We send through a variety of ways that because we're in constant communication with them. So we use those mechanisms to invite them for vaccinations. And so it seems like, to the people, to the general public, it may appear that there's vaccine being distributed, but no one is hearing about it. But that's because the 1A healthcare worker group were contacted directly by us and are coming in for their vaccinations.
Okay, thank you. Thank you. Now, we've got a couple of questions about the difference between 1B and 1C. And one specific one, is there yet a list of medical conditions that would warrant advancing someone from 1C to 1B status? Has that been laid out by the CEC yet, or Virginia Department of Health?
No. All the underlying or the chronic medical conditions that predispose individuals to more severe disease from COVID are all lumped together as the people in 1C. 1B is the priority groups are the frontline essential workers, and then older adults who are older than 75 years of age. So those are the two groups. And under the frontline essential workers is, many groups of people that constitute that designation.
Okay, thank you for clarifying that. And how about spouses? Spouses of somebody, say, who's in 1B, but they're in 1C. Would spouses or maybe other family members be expected to get the vaccine at that point?
So at this point, when we call for a priority group, it really is intended for that priority group as the individual. It's not for families. So it is possible that, members of the same family might have to be in different groupings. If a person falls within several groupings, then they can choose to go into the group that is prioritized, first. But as family members, you have to wait to be in your priority group when it is called up.
Okay, thank you. And let's get into some more timing issues. So, Dr. Gloria, when do you expect to have, basically to have batch 1A? The question is completed, but as you said earlier, they're not going to get everybody in 1A. But when will 1B start? Do you have any sense of that?
I don't have an exact date of 1B, but I know I can say it's going to be happening very soon. Obviously, it was announced today for a reason. We're all gearing up towards 1B, but we haven't gotten the green light to start vaccinating 1B yet.
Okay, thank you. And relating to 1B, I actually missed the governor's press conference today. I did. Was it good? Is it a lot of information, hopefully?
I actually missed it as well. Okay. But I did hear that he sort of outlined briefly who was part of 1B.
Okay. And so along those lines, is Virginia following the CDC recommended sequencing of groups when distributing the COVID vaccine?
Yes, Virginia is following CDC.
Okay. All right. And so is there a question of what percentage of 1A recipients would have to be vaccinated before starting 1B and 1C?
it's not really a percentage as in demand, because it's the same group of vaccinators that will be, at the health department who are doing all these vaccinations, and we have a certain amount that we can do in a day. So if the demand falls, then we would move to the next, move to the next group. We don't want to have vaccinators doing 60% of the capacity. So, we kind of give it a day or so or two, and then we just move to the next level, as given permission by by the state. We won't move to another priority group on our own without seeking permission from the state, or the state can announce and say, on a certain day moving forward, we will be in 1B. When that happens, we will be in 1B automatically.
Okay. And just to jump ahead to 1C, is there any sense of the timing generally for 1C?
So 1B in Virginia is probably in excess of about 1.2 or so million people. And if you look at Fairfax as 1/7 or so of that population, that's quite a heavy lift. And again, it's the issue with the vaccination and the speed at which it happens is, yes, the capacity to vaccinate, but also the vaccines. You can only do as many as you have. And even though we move into these priority groups, we never have all of that amount upfront. So as I said, in 1A in Fairfax is about maybe 75,000 people, but we didn't get 75,000 vaccines on day one. We got 5,000. The following week, we got 7,500. 7,000. And the following week, we got, just yesterday now, we've gotten 12,000. So the vaccines aren't just sitting, they come in smaller quantities. And we are looking, I think, following today's press conference, I think it was clear that the governor wants us to speed up vaccination to make sure that the vaccine gets into the arms of people who are waiting for it and need it. And so we're going to be looking at ways in which we can speed that up. And one of the ways is if these other entities, like the pharmacies and the providers, also receive vaccine and can be part of the mix, right? So I think there's a number of things that are going to be happening. I don't have the details because I haven't been given any details, but as we saw with COVID testing in the beginning of the pandemic, where it was really scarce, and as a result, all of the testing came through public health, and then as testing became testing kits became more widely available through commercial labs and so on, it gave the public the opportunity to go to other places besides just public health for their testing. And so that's the same thing that's going to happen. That's going to have to happen here, which is vaccine being in quantities that are sufficient to distribute across a variety of settings, physician offices, pharmacies, and so on, so that people have a choice as to where they want to get it, and so that there aren't bottlenecks that one particular provider has to be responsible for vaccinating the entire priority group.
Okay, good. I am going to mix in a couple of questions that are coming in on the chat as well, and I'll go back to the questions that we got ahead of time. One question about relating to releasing existing vaccines. So how are we doing on that? I've heard some numbers that sound don't sound great in terms of the number of vaccines that actually have that are sitting in refrigerators versus gotten into arms. How are we doing here in Fairfax County?
So here in Fairfax County, it's a bit hard to determine exactly how many vaccines have been given because there is a system called VIS that we are supposed to input all vaccinations that are administered. So the information that goes through the state is only as good as the input of that data. Here in the health department, and I'm sorry I don't have today's numbers to report out, but as of yesterday, we at the health department had vaccinated a little over 9,700 people out of 12,000 vaccines that we had received at that time. Yesterday afternoon, we received another 12,000 vaccines, and I haven't spoken with staff to see how many vaccinations that we did today. Our daily capacity, the way we do it is Tuesday through Friday. We hold points of dispensing or vaccination clinics in our district offices, and that capacity is around 1,000 to 1,200. And then on Saturdays, we have vaccination clinics at the government center. And that last Saturday was our first clinic or vaccination clinic we had at the government center, and we had about 4,700 people who registered. So during the week, it's a smaller apparatus, and then over the weekend, we have much larger people coming through at the government center.
So let me just follow up on that. So that you're saying the capacity for during the week, not at the main government center, is about 1,000. Is that per site, or is that for overall across the different sites?
Overall across the sites in Fairfax County Health Department.
Yeah.
The hospitals also are doing it as well. And then
the hospitals are doing it in
their venue, and the long-term care facilities are also getting vaccinated through the CVS and Walgreens federal program.
Okay, and the results of, not the results, but the numbers are available on the VDH website. Is that right? In terms of
that is correct.
Not just the vaccine numbers that the health department has, but also the hospitals, the pharmacies, and everyone else, I guess.
Everything is combined for the Fairfax Health District. Yes.
Okay. All right. That sounds good. Let's move on back to some of the questions that were sent ahead of time. And thank you, everybody, for putting questions in the chat and your patience on this. We'll get through these. So do we have an anticipation of reaching major vaccination milestones in terms of the timing of that, such as 100% of our frontline and elderly and nursing homes being vaccinated, half the general population being vaccinated? So do we have a sense, basically, when are we going to get through this in terms of vaccinations? Is that something that you can see in your crystal ball?
Well, if we have sufficient vaccine, and which would mean that there'll be other avenues where we can get vaccine, things will go a lot quicker. We probably could look at going through 1A and 1B through March, and in the spring looking to do 1C, and then moving into the summer to do the general public. If vaccine is not the limiting step. So we do have our work cut out for us. The thing about vaccine, the uptake is that not everyone in our community is ready for the COVID vaccine. So we have a lot of work to do. For example, in the long-term care facilities, one of the things we're doing, because we know it is our hope that we would have a very high uptake, given the fact that a lot of the deaths have occurred in residents of long-term care facilities. But it's important that, to note that there is vaccine hesitancy throughout the general public. And so part of our work also is to educate our community to be able to answer concerns that people might have about vaccine safety. There are a lot of conspiracy theories out there. There also, from personal experience and so on, reasons why people are hesitant, and it's our job to educate. But I think as more people also get the vaccine and people become aware of neighbors or friends of a friend who has been vaccinated and is doing well, I think that will also increase the confidence in the vaccine. We've all heard about the studies and the safety profile, the efficacy profile was quite incredible. However, for some people, these are nameless and faceless people. And so it's nice to know that, your next door neighbor got it, and you get to hear about the experience in terms of what the side effects were, if any, and how they felt, since they got it. I think as people hear those personal stories, it will alleviate some of the concerns they have, and we will encourage them to get the vaccine. It's important because we need to achieve herd immunity. Until we achieve herd immunity and beyond, we will not be able to get back to life as we had it before. And there'll always be challenges. And so I think it's a journey. It's a good journey that we've begun. We have quite a ways to go, and but I think we will get there.
How are we in terms of receptivity to the vaccine? And I realize we're just in 1A at this point, but do you have any insight into how broadly the vaccine is being taken across the 1A population? Are the vast majority of people eligible in 1A actually taking it? I mean, hopefully they are, the healthcare workers and others.
So it's a little early to tell, right? Because we haven't, we've just started the vaccine, the vaccinations. However, I have to say that the first week there was more demand than this week, but it's a little too early to tell. Okay.
All right. Thank you. So a question about vaccine distribution and equity. Is vaccine distribution, does it really depend upon where you are, what your county is or your state, or your connections to good medical care? How are we dealing with making sure that the distribution is done equitably in terms of who really does have the public health priority?
So in terms of the priority, as I said earlier, the vaccine is being prioritized initially, at least, to those at highest risk for serious illness. So we've seen, as this pandemic has unfolded, that segments of our community has not fared as well. And so the what this initial prioritization is about is looking at those at highest risk for serious illness and death and vaccinating them so that we don't see as many deaths as we have experienced up until now. And then the other objective is to target those who are vital to preserving societal functioning. So why did we start with with healthcare personnel? Because we need them to be functioning in our doctors' offices and the hospitals and so on. We're already seeing a surge across the country with an increase in cases as well as an increase in hospitalizations. And we want to make sure that the system that has been set up to take care of us when we're sick really has the people there to take care of us if we should need those services. So that's been that initial focus. And then for 1B, again, looking at societal function, there are some frontline essential workers that if they weren't working, our lives would come to a standstill, and so that's the next level. And then obviously older adults greater than 75 years is also part of the prioritization to those at highest risk for serious illness and so on. Even when you come to 1C, those with underlying medical conditions, regardless of their age, also. Why? Because they also are at highest risk for a serious illness. So that's sort of been the rationale for how these priority groups have come about.
Okay, I want to talk a little bit about age, people of different ages. Children, we've got several questions about children. Are they included with the general population? And what ages are recommended for the vaccine? So what about children? And when that they might be getting these shots?
So as you know, the Moderna vaccine is authorized for individuals 16 years of age and older. And for Pfizer, it's 18 years and older. And so at this point in time, children less than those ages, younger than those ages, are not being vaccinated. There are clinical trials that are ongoing right now that includes adolescents from 12 years of age and older. So until those study results come out, kids less than 18 and 16 will not be vaccinated with the current vaccine that we have.
Okay, understood. And in terms of older adults, we've gotten several questions relating to, I guess, how they can get vaccinated. One person said, as an older adult, I'm wondering how we will know when we can register for an appointment to receive the first dose of the vaccine, and if it will be administered at the government center or if we need to go to a local pharmacy or physician's office. And I know you've addressed some of these things, but is there timing available yet to know how many months or weeks we will wait? So I guess and we're getting a lot of questions that sort of go back to that, how people can actually access it and when.
So when the time comes for vaccination, there'll be a variety of avenues that we will use to announce it. We can, on our website for sure, there are different social media accounts, through the news media. We will make these announcements so people know that it's their turn, and there'll be explicit direction on what people need to do to get an appointment and so on. At this time, we're not making those announcements because we're not in that phase, and we don't have vaccine to give to anyone outside of 1A.
Okay. Here's another experience from somebody who looks like they're in 1A. They received their first dose of vaccine at the government center on January 2nd. Said, I was on the phone for over 1 hour to try to make the appointment, and then on hold for 45 minutes. The person was helpful once they finally got on. There was an hour and a half wait after my appointment time, but then once the entered the building, then it worked. So is there a plan to make scheduling an appointment easier and faster?
Yes.
Tell us about that.
Yes, there is an ongoing work with Department of Information Technology. And I want to start off by apologizing to this individual and everyone who has experienced challenges trying to get an appointment. We have our call system, put it bluntly, has been completely overwhelmed. And so, people were just not coming through, just getting through. We've heard of people saying they actually tried for 2 hours to get before they got a hold of us, and that's very unfortunate. We're trying to change the application, not application, the appointment process by having sort of like an online initial step that people could easily put in very simple demographics, and then they'll get a response back telling them, giving them a time frame during which someone will get back to them, just to set expectation, and then we will sort of reach out, as opposed to people trying to reach out to us and having to stay on the phone forever, it seems. So we do really apologize for that inconvenience. I think starting next Monday, we will have a much better system in place that will be along the lines of what I've just described.
And that will cover the second shot for people that are getting a second shot as well, right?
Yes, and everybody moving forward. It'll be a system that's used by all the different priority groups that will be called moving forward.
Okay, so the idea is then when folks get a shot, they would be allowed, or they would have the opportunity to make an appointment for a second shot at that same time. Is that part of the design?
So that's what we are working towards. I don't want to speak to that because it could be that people will be given the opportunity to go back into the system and make the appointment themselves at that, following their first appointment. We haven't Department of Information Technology and our IT folks are still working those kinks out. So I don't want to commit to one or the other. But for sure, what I do know is that for those of you who've tried to reach us, and for those of you who got through, it's going to be a much different experience the second time around.
Okay, good. I know we've got several questions on that second shot from some people who look like they've gotten the first shot. So yes, it looks like there are some bugs in the system for scheduling, but hopefully with the IT support, those can be fixed quickly. Okay, let's go back to some of the other questions that were submitted ahead of time. You've addressed vaccine allotment. We also have a question about let's see. So, and you talked about the hotline. So here we go. Your website and the Virginia Department of Health hotline personnel point physicians to the provider intent form, yet my physician's paperwork has sat at the state level for 2 months. How many private physicians has the state approved to date? Do you have any info on that?
No, I do not. I don't have no, I don't have a number.
Okay.
But I know that we in Fairfax did actually over the last several months have hired people who have worked with provider offices, with our provider community to help them through that process. So I'm not understanding. I'm not sure whether it's Can you please repeat this individual's question for me, please?
Let's see if I can go back and find it here. Yeah, this says the website and the Virginia Department of Health hotline personnel point physicians to the provider intent form. Yet my physician's paperwork has sat at the state level for 2 months. How many private physicians has the state approved to date? So it looks like there's an approval process for physicians.
There is.
Yeah.
And it's very high approval, actually.
Okay.
I know that, for example, through our long-term care facilities, 100% of them got into the system, and it's not too late. So I don't, if for some reason you haven't been approved as of now, 2 things. If you could please maybe either shoot me an email or Supervisor Alcorn, if you can capture that individual's name and contact investigation. I mean, sorry, and their contact information. I will have one of our staff reach out to them to see what's going on, and we can reach out to VDH on their behalf. But VDH is also working on that. I will not be too concerned at this point. I'm glad you brought it up. We will try to see what's going on, and it'll be an easy fix.
Okay. All right. Thank you. And yeah, Lisa in my office we can coordinate with you on that to put the two together. So a few more questions have come in, and then in a few minutes, I'm going to go ahead and open it up, and we'll have the opportunity. We'll ask folks to raise your hand electronically, and if you're not familiar with this platform, if you click on the participants button, you'll see a little hand box at the bottom right of the list of participants, and you can click on that, and that's how you raise your hand electronically. We'll start doing that in a few minutes, but I do want to go over a few more of the questions that showed up in the chat, and hopefully we'll get through these and then have maybe a half hour or so for questions from folks that have connected today. So, Dr. Gloria, someone asked, can we make an appointment for 1B now? Is that something, that's
No.
Not yet?
Not yet.
Okay. And
so one thing about 1B is it's a very large group. Unlike 1A, where all of 1A had the opportunity to make an appointment for vaccine at the same time, I think that will not be the case in 1B because it's so large. So I think 1B will be done in a way that, calls certain groups of people at a time to make an appointment. And one of the things that we're looking to do with 1B, because we're engaging with other partners outside of public health, is to look for different ways of really vaccinating 1B. Not everybody. Our intent is not to have everyone come to the health department to get vaccinated. We'll be looking at large groups of people and maybe doing what we call a closed pod. So, for example, teachers are part of 1B. In Fairfax County, you're talking teachers and staff, probably 26,000 people. Instead of us getting 26,000 people through our government center or through our district offices, how do we partner with our MRC, our school staff, and so on, to maybe host points of dispensing in the school setting as opposed to in the health department setting. So these are a number of things that we're looking at. And again, really, it really depends on how much vaccine is available at each time, and how many, what group we can kind of wrap our arms around and sort of vaccinate and sort of move through the next group or the next group and the next group.
So let me go back just on that question about teachers. How and I don't know if the governor had any more insight into this, but how soon are we going to be able to see teachers be vaccinated? Is that a matter of weeks, you think, months?
So it's all part of 1B. So 1B is called, I'm just looking up here. So 1B, frontline essential workers, it's police, fire, and hazmat as one group. Mm-hmm. Corrections and homeless shelter workers, another group. Childcare teachers and staff, another group. So the groupings of workers in in 1B, manufacturing, grocery store workers, public transit, and so on and so forth. So it's hard to say, when a particular group of people are going to be vaccinated. They will be called in a certain order, simply because we just can't open it up for all.
And when will we see a plan for, say, teacher vaccination, teacher and staff? Will that plan be within a week of when the vaccines are available, or simultaneously with vaccines being available?
So we have a number of plans, and we just shift as, as vaccine is available, as, we're looking at who the players are at the table, who can, join in the vaccination efforts. So it's really just in time when we decide how we think the best way to address a certain group of people are. Like, even we've evolved as we've gone through 1A. Sometimes we find large groups of, let's say, a home healthcare agency that says they have 600 staff. We are looking at partnering with others. We've been talking to other pharmacies outside of the federal program. So outside of CVS and Walgreens, like Safeway and Giant. And we are working on certain partnerships. We have sometimes, people within the 1B group, the 1A group that are licensed to dispense vaccine. So we work with them and make sure that they understand all the precautions and all the regulations around vaccinating, make sure that they have the right, refrigeration and all that stuff, and we can give them vaccine and they can vaccinate themselves. So there are a number of ways in which we are looking at and working with the different groups to expedite the process.
Okay. Here's a specific situation in the chat room. In DC, there have been stories about people who happened to be at a pharmacy when they were about to close, and there were a few doses left at the end of the day that would have to be discarded if not used. Will Fairfax do that? Or is there a sign up where you can scoot over at the last minute and get vaccinated?
So vaccine wastage is something that we do not want to happen. And so at the Government Center, you'll be interesting to find out that we did not have, at the time we were done, we had 0 doses left. And what happened is, at the end of the clinic, if a vaccinator ran out of vaccine, with the vial that he or she had, instead of opening a new vial, then that vaccinator had to share, with another vaccinator, a vial that was being used, or the number of vaccinators got shrunk so that people wouldn't have to open new vials. And we found really creative ways to make sure that at the end of the day, we had 0 doses left. And we had utilized every single dose that had been opened for that day. So we will not let vaccine go to waste. We have so far in our offices, when we've had these clinics, there are a few people in our organization that have not been vaccinated, and so at the end of the day, we would, send messages to those who may not have been vaccinated to actually come and get their vaccine. So,
okay. Question related to that came in: have any vaccine doses spoiled?
So we, I think on the very first day, it didn't spoil, as in spoil because it got left out and was not refrigerated. But there was a mishap and a vial was dropped.
Okay.
So with that, the vaccine was wasted.
Okay. And that was what, 5 doses, 7 doses?
So they come in a 10 dose.
10. Okay. So does the vaccine prevent you from being infected with the virus, or does it just make the infection less intense?
So what the clinical trials showed was that they both vaccines are highly effective in preventing disease. But what we don't know is whether people who've been vaccinated can shed virus even if they don't get sick. And that's why the recommendation is that vaccinated people continue to wear their face coverings and practice social distancing.
Okay. Question about second shots again. Are the second shot doses being reserved now, or do we depend on manufacturers for the second dose? So basically, are we banking on them being manufactured and shipped, or are we giving the first dose knowing that we already have the second dose?
Not us at the local level, but at the state level, they're giving the first doses out, knowing that they have the second dose as well.
So they're in hand at the state level. Okay. All right. So just looking through here, why was age 75 determined to be the age cutoff for high priority? Other countries consider the age to be 70. Do you know?
I don't know.
That's a CDC thing?
That's a CDC thing. What we do know is that with advancing age, the severe illness and adverse consequence from getting COVID increases. So it's significant between, let's say, 65, 75, 85 and above and so on. And so that was a cutoff that the ACIP, the Advisory Committee on Immunization Practices, came up with.
Okay. And a question about planning for this. I believe the health department set up the internal work group on starting the planning process for vaccine distribution last summer. Is that correct?
That is correct.
Okay. I got a question. We've known that the vaccine was coming for a while. Why weren't these distribution avenues and logistics prepared in advance to have enough distribution capacity and scheduling available for all vaccine that is available to the Department of Health? Or are they? I mean, where are we in terms of the vaccine, the logistics plans?
So the plans are there. The challenge is you don't know how much you're getting. So you're constantly changing. I mean, like we know about, COVID, there's always new information. And also we are not in control of setting the priority groups, how much vaccine comes. And so you're always playing it by ear and pivoting and, looking at different ways of accelerating that process. So it's not a surprise that the vaccine is coming in small quantities. We got that rude awakening with H1N1 when we had plans of these mass clinics in 25 sites with lots of Medical Reserve Corps volunteers and so on. And then there wasn't vaccine, and we had to quickly downsize those plans and do it at the government center. It's the same thing that we're doing now. We have to realize that as vaccine has become available, nothing has really changed. In fact, it's gotten worse in terms of the cases are surging. Our plan, a strategic approach to box the virus in continues to be a priority. And so it's the same people in the health department that are responsible for doing the contact investigations, doing the community testing events, working with long-term care facilities, because we're seeing also an increase in cases there. And it takes quite a bit of manpower to keep the outbreaks from occurring in the long-term care facilities. So all that is going on. And then now we have vaccines that we have to administer. All of the things I talked about are priorities that have equal importance. And so, you know, we're doing the best we can. I think we got off to a little bit of a not so smooth start because of the phone. Our phone system was quite disappointing, and so we've had to change, quickly how people indicate their intent to get vaccinated. That was a surprise. It didn't go as smoothly as we had hoped it would, but I do sincerely apologize for that, especially to those who have tried to make an appointment. And I think that next week, people who are trying to make an appointment will have a much different experience.
Okay, thank you. I just got one more question, and then I'm going to look to see if there are participants that have raised their hands, and then we'll unmute folks one at a time, and they can ask their questions. Question, you mentioned earlier how many in Fairfax County were in the 1A group, roughly. How many people are left in 1A to be vaccinated, or at least approximately? Do you have an estimate of that?
So I would say we probably have done half, not just the health department, but in the Fairfax, between us, Inova Hospital, Reston Hospital, which are the three entities, and the long-term care, the pharmacies that are doing the long-term care facilities. I would think that we've sort of hit the 50% mark or close to it.
Okay, great. Okay, fantastic. Well, let's go ahead, and I see we have 3 people with their hands up. It's 801 left, and the first person is Timothy Hughes, and Mr. Hughes wins the award for the most comments in chat, I think. But you are also first in line to ask your question, so go right ahead or make your comment. Yep, Mr. Hughes, I'm sorry, we can't hear you. You may have your computer on mute.
Hey, I'm sorry, I can talk?
Yeah, there you go. Please do.
So 1C has, I don't want to read it, but pretty much anybody in Northern Virginia qualifies 1C. I'm an information technology worker. I'm obese. I have diabetes. I go to the doctor and I get any excuse known to man. I'm a teacher. I'm a grocery store bag boy. How in the, honestly, are you going to subcategorize that? Because this is literally going to be a free-for-all. How are you going to prioritize that?
So
other states prioritize within those priorities for what it's worth. Just so you know, you might want to look around at what the other states are doing.
For 1C?
The CDC guidelines are guidelines, by the way. They're not rules, they're guidelines.
That's correct. But we are also subject to what Virginia Department of Health puts forth as guidance for us to follow. And so that's what we're doing. All of the 35 health districts in Virginia are following what has been told.
So a 24-year-old bag boy who's completely healthy is going to wind up before a 65-year-old with a kidney transplant, immunosuppressed person in their 60s. It doesn't make any sense.
But
what happened to do no harm?
But 1C, we haven't even talked about 1C yet. But I suspect that by the time 1C rolls around, vaccine, we cannot do, let me put it this way, we cannot do 1C under this system. That's what the private doctors were encouraged to sign on for. So at that point, I suspect we'll have it in doctors' offices.
Even if you give it to CVS and you prioritize, okay, we're in 1C, there should be a priority within 1C. You come into CVS, you show them your driver's license. Are you over 60 or are you under 60? Are you over 55 or are you under 55? Are you over 50 or are you under 50? Do you have medical condition? Show me how. There has to be one would think that common sense would prevail and you would provide some sort of guidance in terms of here are the priorities of people that will actually die from this virus versus people that are not going to even get sick. It's not like it's not known. There's tons of information, tons of science, tons of science. Do you read the science?
All right, let's go ahead, Dr. Goy, please answer, and then let's move on.
Yes. So, I mean, I think we should wait till we get to 1C. The Virginia Department of Health, for example, and at the state level for 1B deliberated. There's a little task force, I shouldn't say little, but there is a task force that they put together to really look at what the ACIP guidelines were and to sort of tweak that and to make it applicable for Virginia. So we've only talked about 1B. No one has talked about 1C in terms of the specifics of 1C. But by the time 1C comes around, there will be many other players in town who are able to distribute vaccines, and I don't think that that there'll be the same bottleneck that you may have seen now and are concerned about. I think there'll be much more vaccine available, and people will have the chance to go anywhere that they want to go to, either the doctor's office or a pharmacy to get the vaccine.
Okay, let's move on. Thank you, Mr. Hughes, for that question.
If I can add something, the same
Sure.
said of, let's say, flu vaccine. Flu vaccine is free for all more than the 300 million of us. But it's people get it in different settings, and there isn't that queue for it. Number one, because not everybody wants it. There are some people, even with 1A, not everybody in 1A is clamoring for the vaccine. So there's that initial demand. And then, as I said, our demand last week was much higher. We were full. It was much higher than this week. And so, which is part of the reason why I think Virginia will be moving to 1B shortly. I don't know when that date it will be, but I think that it will be in the very near future. But it doesn't mean that when we move to 1B, that the people in 1A who want it won't be able to get it. Of course, they can come anytime they want to and get the vaccine. And the same thing by the time we get to 1C, it'll be the same. But everybody's going to want it. You might have to shop around a little bit to find it, but I don't see it as being as problematic as it is right now.
Okay, let's move on. Michael Jones has his hand up, so the floor is yours. Go right ahead.
Hi, my wife and I we watched the press conference that Governor Northam did today, and he indicated that we should start
I'm sorry, Mr. Jones, could you speak up just a little bit? I'm sorry, we can barely hear you.
Sorry, my wife and I attended and watched the press conference that Governor Northam did today. Can you hear me now?
Yeah, I can hear a little bit, but go ahead and I'll repeat the question.
Okay, well, we attended or watched the press conference, and he indicated that we should start registering for 1B before it's being administered, so you're not waiting to get it out to people. My wife particularly is 1B, and he indicated you should be able to start registering now, and that, just as the other gentleman said, that all these things are guidelines, not necessarily rules, and that we should be pushing to accelerate the administration of these vaccines. So anyway,
yeah.
So I don't know, what do you think of getting it so you can start registering people now or soon?
So thank you very much. Did you get that, Dr. Gloria?
I did.
Can people
Start
register
registering
now for
for
1B?
1B now. And what I'll say to that is, at this point in time, we will not be registering people for 1B simply because of the issues that I talked about in terms of our IT system. It just doesn't make sense when with 1A, we're having such difficulty and then we're adding on 1B. And also because 1B, again, I didn't hear the press conference, but the impression that my understanding about 1B is that it also has the different groupings. And it was my understanding that all of 1B wasn't going to be called up at the same time.
Okay. So how will you verify that somebody that signs in as being in 1B, let's say a teacher, is actually a teacher and not something else? How would you confirm that they should be getting the vaccine, first on?
So one of the things I think you're talking about identification of people and making sure that they belong to the subgroup that is being called on at the time. Is that correct?
Yes.
Yes. So identification is one way of doing that. IDs. I have to say that for 1A, we did not require people to bring proof of identification to the clinics, either at the government center or to the district offices. We had a verbal attestation. The IT solution that we're looking at will have 2 attestations as part of it. And at the end of the day, we're trying to make it more user friendly, and I know that is subject to abuse, but I would hope that people will do the right thing. I mean, if you are asked to attest twice during an application process, and as an individual, the person wants to cheat, that is unfortunate.
Thank you.
Okay, thank you, Michael. We have Carl Mitchell next. Carl, go ahead and unmute, and the floor is yours. Carl, you're still muted. There we go. Carl, there you go.
Can you hear me?
Yes.
Okay. I'm 70. I have cardiac disease, and therefore I'm in 1C. I missed some of the earlier parts of this because of a conflict, but I'm basically wondering when 1C is going to become available, and where do I register to be in 1C once 1C starts?
So when 1C is announced, we will, that's the time when we will be inviting people to apply, not to apply, but to register for an appointment. And we will at that time announce how it'll website, it'll be through our website. But at this point, we are not making that as an option for people to register ahead of time.
And what would you guess at when 1C will start, the system will be available?
I don't know for sure, but I would say maybe in the spring.
Okay. All right, thank you.
Thank you, Carl. Next, Sheila Dunheimer. Sheila, you're up.
Hi, can you hear me?
Yes.
Okay. First of all, thank you, Supervisor Alcorn, for holding this meeting tonight. I appreciate it. And the question I have is the 1A CDC and ACIP guidelines state that only public health workers or community health workers, including call centers that cannot work remotely, would be eligible for the vaccines in the 1A group. up to this point, Fairfax County has, their contract tracing employees should be working remotely, but they've refused to allow that to happen. So that would be the best protection for them. And it would also have saved us $2 million in CARES money that was spent renting 120 guest rooms at the Marriott Fair Oaks. And so a domino effect also of the on-site requirement is, from my understanding last week, these employees were administered vaccines, and there's 300 probably plus employees that would have been eligible for that to 400. And so that redirected that scarce vaccine to these employees whose only contact is on the phone with positive cases. And then you're stating that you've only been able to get vaccines to about 50% of the 1A group. I mean, how do you justify those decisions?
There's so many things you've said, and I believe that you have voiced these concerns in the past through a variety of channels with the county, and so you've asked so many questions. How do I justify what?
How do you still justify requiring them to work on site and not allowing them, like every other county around us and Maryland and DC, to work remotely? The numbers don't justify, they're not any better than any of the other counties, so they don't justify requiring them to work on site. Why do you insist on them, having that format for work?
So I don't know what you mean by the numbers don't justify. The Fairfax County's COVID stats have been very good compared to our neighboring jurisdictions for a long time. And we adopted and are looking to box in the virus. That's the approach we're taking. It was my decision to have a in-person workforce because that's the work. That's how this is done right. Even for seasoned public health employees who've been doing contact investigations, it's always been an in-person endeavor. Let alone for individuals who are coming at this without any experience. And so it was for that reason that I decided that all the IPHI employees that were being hired for contact tracing should, like all the other health department employees, be on site to get the job done and to do it properly. That's where I don't know I hope you've been following what's been happening with a lot of states and even here in Virginia, other jurisdictions, as it relates to contact tracing. States got overwhelmed. There are some states that are not doing contact tracing at all. We have prioritized because the cases were so overwhelmed. We, as in Virginia, prioritized because the cases were overwhelming. In Fairfax County, we have not prioritized. We are conducting case and contact investigations just like we have been doing since the beginning of this pandemic, because our goal is to try to put pressure on the virus and to try to box it in. We are a huge jurisdiction. If our numbers explode, it will severely impact the neighboring jurisdictions as well.
Well, I would challenge your statement about the numbers being better. And I think $2 million spent when CDC itself recommended it be done as a remote, and everybody else has been able to do that and save that $2 million and not expose those people unnecessarily to unsafe working conditions that you are under OSHA investigation for. So.
Okay, thank you.
I think we can take that offline. You have communicated this through a variety of channels in the county. And so I think that I welcome the opportunity to discuss it with you further. We don't need to spend the time on this podcast to actually do that.
Okay, thank you, Sheila. And let's move on. We've got two more hands raised. The next one is AS. You are unmuted.
Supervisor, for hosting this session. You have a very difficult job, so greatly appreciate what you are doing and you continue to do. Having said that, I do want to express my disappointment. I posted this question on the chat as well. I believe had we planned accordingly and involved the correct experts, we could have involved some queuing theory engineers and traffic engineers who could have easily come up with a phenomenal solution to prepare the logistics for this vaccine rollout. I understand we didn't know how much vaccine we would be getting, but we did always know that it would be in limited quantity, and we always had our population data. We could have easily come up with the logistical solution. A phone number not getting through is just not an answer in this day and age. Having said that, I do want to get to my question. It is very disconcerting to hear throughout the country and very close to us in DC. Obviously, somebody asked this question already, that pharmacies are coming up at the end of their closing time or their shift, that there are some leftover vaccines. I know you addressed that question at the government center, but it is very, very hard to believe that there will never be a situation where there will be leftover vaccine. I do want to encourage the county and yourself to come up with a solution where perhaps there is a way that general public, people from the general public, can get on some kind of a standby solution, and if they are around and they're available, to come and get that vaccine. Because from what I've read, about 40% of the 1A group is either not showing up to their appointments or they're just not ready to take that vaccine. Thank you.
So again, in regards to the issue about the phone, I completely agree. Again, it's very unfortunate what happened, but we're trying to fix that. And but in spite of that, we have vaccinated. It hasn't limited the number of people that we've been able to vaccinate. We've had full clinics since we started last week. In regards to vaccine being left over and going to waste, that's not going to happen here at our health department, because, as I said, we begin to limit how many vials are opened after a certain time during the vaccine clinic. What we're looking at is, because on Saturday when we did that, it did slow down things quite a bit, because all of a sudden you go from like 50 vaccinators to 40, because we're not opening new vials and then trying to dwindle it down. The reason why we don't have any, we're confident that we're not going to have wastage is because not all of our staff are vaccinated. And so every day in the clinics, when it comes to the 2, 3, 4 doses that are left, that's when we vaccinate some of our staff as well. It's already an available workforce that has not been vaccinated, that we're using to ensure that we don't have any vaccine wastage. Once we've gone through that, yes, we are looking at how we expand that to others who can come on a very short notice and get vaccinated. But we do have volunteers as well. So on Saturday at the government center, for if you know any volunteer who participated, typically when we have volunteers, we would have vaccinated them at the start of the shift. But this time around, we did it at the end of the shift, again, so that we could control at the end how vaccine was being distributed without opening new vials. And we're just going to have to continue that and try to look at ways to improve our process as we move forward.
Okay, thank you. We actually have 2 questions left. We're coming up on 8:30. Next we have Etienne. Go ahead.
Do you hear me?
Yes, we do.
Okay, thank you so much for your effort, and it's very informative. I have a question about your relation with FCPS, the Fairfax County Public Schools. I wonder if you give them some ideas about what is reasonable or not for the teachers to be exposed in person when we have a reasonable system remote. So I would like to know if you believe that FCPS should wait for the teachers to be vaccinated before calling for return to school in person. I'm a 1B 76. My young wife is a 1B teacher, and I have underlying condition. I find it very difficult to understand why FCPS would ask every 2 or 3 weeks come back to test the kids in person. I don't understand it.
So if I can clarify the question, you don't understand why FCPS is looking to do in-person learning?
To bring back in person the teachers who are doing work in a remote fashion before we get the vaccination. With the new strains that are coming to hit us, I don't understand why we're going to put everybody at risk with everything we know now. So do you give them information, or do they just act by themselves?
All decisions regarding students returning to school or teachers going back to work are FCPS decisions that they.
That's they don't ask you for your advice.
So we give them guidance in terms of what does it mean? What does it mean when we have community transmission, and how does that impact school transmission? So if you've been watching the school board meetings, that's the advice that we've been giving, which is community transmission does not necessarily have to mean school transmission. It will if certain mitigation actions or measures are not taken, like everywhere else. So we all, I mean, I can speak for this building that I'm in right now, health department building. Since the pandemic, we've almost doubled in terms of the number of people working here. But with mitigation measures, we have not had outbreaks. Have we had a case? Yes, because you will have a case so long as people live in in communities and are gathering as part of their private lives and doing the things that we all do in our private lives. Those things put us at risk for COVID because we have widespread community transmission. But community transmission does not have to mean that there's transmission within a building. There's certain things that when you do inside the 4 walls of the building, that limit COVID transmission. So that's the kind of guidance that I have given to the Fairfax County Public Schools, guidance that we live by here at the health department, same guidance that we've given to Fairfax County government, which has enabled them to come back, to operate the SRS program, the Camp David, which is also a child a camp program in the summer, and to do it all successfully. When I say successfully, it doesn't mean that there was never a single case. There were cases. Those cases came from outside the building.
Exactly. That's the problem with the school. The problem is not the school itself.
That's
The
correct.
problem is the children. I can see all the kids playing together without any social distancing or anything up to 20 years of age. And we know very well that they carry they are asymptomatic people, and they carry it even more than adults. In my long career around the world, I've lived through other pandemics, and I could see this in every school. The parents are not capable of taking their kids and keeping them. So when they return to school, it's not because of the school, it's because of our life. We live happily until we get the COVID. That's the problem. It happened with the H1N1, it happened before. And I'm trying to get my head around the idea that I might die because it's going to come from outside, and the school will say it's not my fault. You're 1B, but your wife has to come before she can be vaccinated. That's what I don't understand. Doesn't make much sense. But I kept you too long. Another person wants to talk to you. Thank you.
Well, thank you. And actually, we're going to continue, I think, on the school's theme. We have one final questioner, and Pam, you're up. And I don't think you're going to disappoint me and ask a non-school question, but ask whatever you'd like. Pam, go ahead and unmute yourself there. There you go.
Can you hear me?
Yes, there we go.
Hi, thank you. And thank you to I was listening to yesterday as well at the very long school board meeting and at the other meetings they've been on. I appreciate all of your work with Supervisor Alcorn and with the schools. I actually have a question, about two questions. One regarding proactive or surveillance testing, whatever we're calling it, and then also about timing regarding vaccines. The first is regarding testing. You were talking yesterday about not being real supportive of the use of the rapid test because of the concern about potential for false positives. But then you also said that you guys have worked really hard to bring capacity up for PCR testing, could do up to even 1,000 a day. And you did that partially because you figured that all these kids would be in school at FCPS. And so you ramped up your staff work there. If we brought kids back in, teachers back in, especially to the concerns the previous gentleman was just saying, let's say we brought back in groups 1 through 4, we're only talking about a few thousand people. Could we do regular testing using PCR testing? PCR, I think that's the right term, right? On a regular basis, like my kids in college, other colleges have been doing an amazing job with that. And almost create, it's not an exact bubble because you still have people going home, unlike colleges, but it would definitely reduce, and it would also, I think more importantly, help to identify where clusters were before they got bigger and before they maybe even hit in community in school transmissions. So my question is, why have we not been talking about doing that on a more regular basis if we brought the schools back in?
So we have not opted for what do you call it, surveillance, using testing as a surveillance tool, simply because it really is not necessary, and it actually can give a false sense of security. I know that, you know, I used this example before at the school board meeting when I talked about what happened at the White House. It's not about the fact that they were not wearing masks. The fact is that they felt comfortable because every time you enter into that surrounding to the White House, you have to have a test. The tests don't always detect people who may be positive. And then also, it depends on when you do the test. So it's possible that early this morning, I come to work, I may be tested for COVID, and my test might come back negative. But then during the course of the day, this evening, this afternoon, I might actually, if I got tested again, I could actually test positive. But since I tested negative this morning, everybody who went through is feeling very safe, and it breeds complacency, and it is absolutely not necessary when you have symptoms. Number one, educating parents about making sure that people don't come to work or go to school when sick. And the same thing holds for the teachers and for all of us. We shouldn't be going to work when we are sick. And then secondly, maintaining that 6-foot social distancing. That is so critical. The virus isn't able to be transmitted if we stay within that, if we stay apart by 6 feet. A lot of the times when we do contact investigation, it's because people violated that 6-foot social distancing. Oh, they were looking over each other's shoulder, looking at something on the computer. Or it was during the lunch break room. They were in the lunch room during their break, and they had their masks off. They're feeling comfortable with each other, and were sharing whatever, talking and doing other things, and transmission happened that way. It's through closer contact. And so that's what those mitigation measures are about. Wearing the face mask all the time, which we now know protects the wearer as well as the person, as well as others around you, cuts back on how much inoculum a person can actually inhale, which is part of the reason why, even though we were seeing a lot of cases, that we weren't seeing the concomitant rise in hospitalizations and deaths as we did, let's say, previously, early on in the pandemic. So we have these non-pharmacological interventions. They work well. And I think this is part of the larger problem for this country, where we haven't capitalized on these non-pharmacological interventions. And
if I may, because I know it's getting late, I 100% agree with you on the mitigation measures, like 150% agree with you. You're absolutely right on all of them. What I'm suggesting is that we would do it as an extra thing. And I'll just leave it that, and maybe suggest, and I assume you've already dealt with this, Boston University, William & Mary, Cornell, there are so many colleges that have done all of what you said, and the testing, and their numbers are like 0.04%. We're looking at 14, 16% this week. So I highly recommend that it is not this idea of not necessary or false sense of security, if it can be done in addition to, especially as we're talking about with the schools, and to the point the gentleman was making, and it has to be regular. You're right. Like, it can't just be once. It's got to be, I think they're saying at least once a week, if not twice a week. But I'll move on past that, because I know you've spent a lot of time on it. And then my follow-up question is not about that at all, but about, you also mentioned yesterday I think there's like 600 cases in total in all the different school settings in Fairfax that have been open. But really, it was the 20 or 18 school transmissions. And you mentioned that they had been investigated. And then I think the schools folks mentioned that, I think it was 2, and then there was maybe another group that had actually been from a student to a teacher. So very, very low numbers, which is awesome, and exactly what you've been saying, that school is not a super spreader. And if you do all the things you've been saying, that they can be opened for the most part safely. But can you speak to, and it goes to kind of what you were just saying, where was the gap there? What happened in those 20 cases? What are the investigations showing? Was it that people didn't wear the mask, that they didn't stand the 6 feet apart? What are you seeing of those 18, 20, I forget?
I'm sorry, I can't speak to that, to those specific outbreaks. We've just had too many outbreaks for me to remember the specifics of that.
You can't speak to what's been going on generally in the schools where we've had some school transmission?
No, I can't speak to, I can't speak to those 18 outbreaks that you're talking about. Many of them were quite a while back, and I have not paid attention to the details of why there's an outbreak. It's usually one of several things. The definition of even becoming a contact of a case is having been within 6 feet of someone who is infected for more than 15 minutes. So right there, we shouldn't even have contacts to cases if that 6 foot social distancing was never breached. So that's the first thing that makes you a case, that makes you a contact of someone.
Well, let me just go back. So we just had a 5.5-hour school board meeting where they're trying to figure out whether they should move forward or not. And we have no idea. And these happened in November and December was my understanding. 9 in November, 11 in December. So these were last month. Is there someone in your department who's tracking them more closely? That
of course.
Be able to answer this question in speaking particularly with the school board? Because that's the question, right? Like, so what's happening? And more importantly, then what can they do differently when it is safe to open the schools? Like, that's what I'm saying.
Yeah, so that's what I'm saying is not following the social distancing is what makes a person a contact in the first place. So ideally, we shouldn't have contacts in the school if social distancing is practiced all the time. That's rule number one. So the fact that there's a case and we even have to investigate 4 contacts right there means that regardless of everything else, it means that 4 individuals were within 6 feet of the case for that period of time. So,
but I think that's the concern between teachers and students, especially the groups that we had in were special. I do special ed work that were special ed. Kids in special ed in many cases can't wear the mask or were young or whatever it might have been. That's some of the concerns the teachers have been sharing. So I think it's very important. And Supervisor Alcorn, I'd ask you to follow up on this, and I won't take anyone's time more, at least on this point tonight. But this is one of the core questions that the school board is saying, what exactly is happening? Where are our holes so that we can—
the schools know that. So the schools know that. So for every situation that is investigated, the schools know what happened.
But the school board was asking about it, and the public's trying to figure it out. I'll move on that. My very last question, and you may have answered this, and if you did already, I apologize. So if we're halfway through 1A, what is your sense of finishing up 1A? And when we get to 1B, is that like the next day you start with what's left? And or are we waiting in the state of Virginia for another batch of vaccines for 1B and we don't know about that? So when do you think
we get vaccines? Vaccines come in on a weekly basis, based on orders that we put in. You can put in an order, it doesn't mean you're going to get the amount, but vaccines supposedly will be coming on a weekly basis. 1A and 1B is just going to roll in to the next phase. We will know when we're given the green the green light for 1B, and if Virginia says starting next Monday we're in 1B, we'll be in 1B. So the Saturday before we'll be doing 1A, and if Virginia says we're in 1B the next day, that's when we'll be in 1B.
So we're waiting on Virginia or Department of Health in Virginia to make that call, I guess, to you guys. And we have absolutely no idea when we start with 1A to 1B. Clearly, I'm asking because this is part of the teachers and all the other folks that are like, when do I get it? So do we have a sense that that's in 3 weeks? That's in a month? Do we have any? I mean, you've been on a lot of calls, I'm sure. And this is the big question, right? I know.
Yeah, I mean, I think, again, I didn't watch the governor's message today, but obviously for him to have talked about it means that that time is approaching. We've been doing 1A, we have to move to 1B. He and only he with VDH can say when that day is. And just like he was the one who brought us from lockdown to the next phase and the next phase, it'll be the same way. And it's not a local decision. And but when the call is made, then we implement whatever needs to be done.
But he must be giving you some sense or some headway, because you need to prepare your staff, you need to prepare your IT, you need to. So like if he says on Saturday we're doing this on Monday, you're behind the 8 ball, whatever the term would be. I mean, there must be some sense, like, are we talking about, and I know you don't know specifics because you're waiting, but are we talking about, 2 weeks? Are we talking about 2 months? You're in all these meetings. What are you hearing the ranges?
I think it's quite evident that time is imminent. I don't know exactly what day. It is not 2 weeks, but it's not today either. So the important thing is just that we are ready. We will not, if we move to 1B, if our capacity on Saturday is 4,500, it's not going to become 10,000 that day. So it's just getting more appointments and in and looking at the screening questions. So right now it asks for you to attest that you are a healthcare provider, you do X, Y, and Z. It will ask you a new set of questions, and if you attest to it, and you'll be moved to the next level, which is making the appointment. So it's going to be the same process. It's just new groups of people with different attestation questions that will be making appointments, and we'll be filling it in. The people on the end making the appointments won't know the difference. It's just there'll be a pipeline of people wanting to make appointments, and that's the way it's going to go until we have other avenues through which people can get vaccinated, which is the doctor's offices, the pharmacies, and so on. And when that happens, we will then make the announcement, and people will know that you are welcome to go to any pharmacy you choose to, or certain pharmacies if there isn't enough for every pharmacy, and your doctor's office, and so on. So that information will be made as vaccine availability improves, and as we get the green light to go to the next level.
So it does sound like you think that it'll be this month.
Oh, yes.
And about how long do you think 1B will take, depending on, I think you said yesterday, like 200,000 people in Fairfax or something like that? I'm trying to remember what you said.
It's about 1B is around 200,000, 220 or so.
But yeah. Mm-hmm. How long do you think 1B will take in total to do? Let's say once we start, like a month to get 220,000 people vaccinated?
I don't know. I can't tell you right now, because if it's just us, public health doing it, it's going to be a lot slower. As I said earlier, I believe I've said a few times, is that we're looking to expand the avenues through which 1B can be done, either through a closed pod, and I think I said this earlier, for, let's say, FCPS. So if we do a closed pod for FCPS, it would just be FCPS staff over a series of multiple days, and that's just how it would happen. So
so it could take a week to do once it got started. I know there are the 2 times and 21 days in between, give or take, depending on which one. It could take like a week, assuming you got lots of volunteers from FCPS and stuff like that, to cover the FCPS employees. Give or take. I know I'm pushing you. I know.
Certainly, everything we do, FCPS is a priority. We've been dedicated to ensuring and helping FCPS operate their in-person school plan, which is why we've been meeting with FCPS colleagues since, I believe, March 4th, weekly, every Friday, and multiple times in the week sometimes, to provide information, provide guidance, and it's the same guidance, it's the same information we provided to Camp Davis, Camp Fairfax, and to the SRS program, and to many other, George Mason University. They've done very well in terms of outbreaks. It's the same guidance that we provided them. And we'll continue to do that to all our academic partners, to help them have successful in-person experiences. So FCPS is no different.
Thank you. Thank you for answering all of my questions. And I know I kept pushing, but I'm sure a lot of other people are thinking the same thing. So thank you for all of what you're doing, and good luck out there.
Thank you, Pam. We've run over, and we keep getting more questions in, but at this point, I do want to bring this to a close. So anybody that didn't get a chance to ask their question, feel free to contact my office. Happy to either point you in the right direction or see if we can get information as well. Dr. Otto Ayensu, thank you very much for being on this call. I know you have a lot of things going on that are taking your time, and taking 2 hours out here to be on this town hall is very much appreciated. And thank you to everybody who participated on this. And everyone be safe, social distance, wear your masks, and please have a safe, healthy evening. Thanks all.
Thank you very much for the opportunity.